And we are so grateful and honored to have a leader such as Dr. Cerise in our midst. And so thank you so much for what you do, and glad that you're here to really help frame our conversation tonight. Dr. Cerise.
Thank you, Michael. And the reason the foundation is having such great success is because this guy shares those values and is such a strong leader of the foundation, so thank you. All right, well, welcome to Parkland. Thank you for being here this evening to participate in this conversation. Most of you know this place very well. You know, Parkland is a safety net for Dallas County. What does that mean? It means that many of our patients don't have other options for care. Almost 50% of our patients are uninsured. About another quarter are on Medicaid, which is the federal state insurance program, primarily for low-income people who otherwise would lack access to care. So about 75% of our patients, many of those have limited options. They depend on Parkland for their care. If you look, and that is for all their care. If you look across the county, about 1 in 4 non-elderly adults, or people of childbearing age, 1 in 4 are without health insurance. That's a dramatic number. It's about twice the national average. So the need there is great. And if you think about Parkland's mission statement, it starts with advanced wellness. People know us as the hospital and all the acute care that happens there, but we start with advanced wellness. And we can't advance wellness without having attention to reproductive health care. Such an important part of wellness for young women, from a physical, emotional, economic perspective, and we take that responsibility very seriously. We will do about 40,000 family planning visits a year in our system, about another 40,000 GYN visits. Despite that, Dallas has one of the highest teen birth rates in the country. We're about 0.25% higher, 26% higher than the Texas average, about 84% higher than the national average in terms of teen births. So we know we've got to do more. We deliver about a third of the babies in Dallas. With these very robust family medicine and GYN activities, we realize that with that activity comes a responsibility to lean more into family planning, into reproductive health care. That perspective, that part of the continuum. And so over the past several years, particularly given the politics that are going on across the nation in Texas in reproductive health care, we realized the responsibility is even greater to have accessible programs for women that want family planning services. So for the past couple of years, we've been having a lot of conversations with these two on the end that you're going to meet. And Rupert was just telling me, how she could be, what did you say? Anxious. I said we need some anxious people, and Alan will push hard as well. And under the sort of the leadership, they're going to talk to you about some of the work that they've been up to. We've done things like expanding hours in our family planning clinics. So we'll have extended hours with evenings and weekends now. Adding a teen clinic at our CV Roman site so that teens can get access to services outside of school hours. You've done things like immediate postpartum LARCs, long-acting reversible contraceptives. That was sort of a nut that was tough to crack. To be able to put those programs in place, these guys have led the work, and I'm looking at Paula and Nicole and others who have been really critical to that work as well in the audience. And then you will see, I didn't see it, is the family planning van out?
There'll be a big reveal.
Sorry, I said that. You'll see the newest piece of equipment, which is a family planning van that will be visiting schools, colleges, community centers to be able to bring more services where it's convenient for women. So you'll hear a lot more about these things. Let me just say, thank you to the leadership and Amy and Lauren as well. You're going to meet all of these people. Thanks for coming tonight, to listening to this important conversation and supporting this critical work that we're trying to do here at Parkland. So thank you. And Michael, who am I turning this over to? Lauren?
Okay. All right, thank you so much, Dr. Cerise. And thank you, Michael, both for helping us understand more about Parkland's role and your expanded plans to help provide the critically needed family planning services here in our community. So I brought my index cards with questions, and you should all have index cards too. So as we go through the evening, please take a moment, jot down questions as you think of them, and then you'll just pass them in towards the aisle, and the Parkland Foundation team will collect them, and hopefully by the end of the evening we'll be able to get through some of those questions as well, in addition to the ones prepared here. We have an incredible group here today, and a diverse group with lots of different experiences. So I just want to take a brief moment and level set before we begin and make sure that we're all coming into this conversation on the same page. It's not hyperbole to say that women's healthcare and family planning is in a crisis moment right now. It's not hyperbole. Every aspect of it, from IVF to abortion to contraception to maternal health, is currently being legislated or litigated somewhere in the system. And the ripples from all of those pieces are going to be felt across the community for years to come. That's why we're here today. And that's why we support the great work that Parkland and others are doing to address these issues. For us to better understand the current women's health landscape and the inequitable access that many of our community members face, it's really important that we think about how we got to this current state. So I'd like to start with Amy, and I'm hoping that you can give us a little bit of historical context and perspective to help us understand how we got to this moment.
Thank you so much, Lauren. Thrilled to be here with this awesome group. So to sort of set the context of where we are right now, what I want to frame this conversation of is a dichotomy between reproductive rights and access. And to understand that, we're going to go back to 1840. And what was happening then, so I promise I'm not going to be like, every moment that until today, don't be scared. What happened in 1840 is that a physician named Dr. Marion Sims, who was credited for decades as being the father of gynecology, pioneered many of the instruments that OBGYNs use today, and did a lot of work on repairing fistulas, which, as you all know, is a complication that women can experience, particularly low-income women, women without access to health care during childbirth. The way that he did this was by performing hundreds of surgeries on enslaved Black women. And while most of those women's names have been lost to history, we know three: Anarcha, Lucy, Betsy. Anarcha had 30 surgeries performed on her, unnecessary surgeries, without anesthesia, and without her consent. As an enslaved person, of course, she could not consent to surgery. And that is the thread that has pulled through of white supremacy and racial discrimination to healthcare today. And the way that we see that is that even before the Dobbs decision, which overturned the right to safe and legal abortion in half of the country, what we had were people who may have had the right to access abortion, the right to access contraception, the right to access prenatal care, postnatal care, but they did not have the ability to access it. So this, when you think about inequity in our healthcare system, it's not a bug, it's the feature. It's doing what we built it to do. And I think that that's really important when we think about solving for access to reproductive health care, that it's not just where is it legal for someone to get a long-acting reversible contraception? Where is it legal for someone to have a midwife or a doula care for them during childbirth or post-childbirth? But where does each person have the ability to access that care that is right for them, that is right for their family? And it has been decades, hundreds of years that we have built in that inequity to our healthcare system, and it should not be honestly a surprise to any of us that what we created in our healthcare system is now what is happening in our healthcare system.
Thank you for that grounding for all of us. Alan, I'm going to come to you next. CPAL is known, so Alan is the executive director, CEO, he's in charge of, but I don't know exactly what the title is, of CPAL, the Child Poverty Action Lab. And CPAL is known for using data to define and then address issues across our community. So you've made huge strides in eviction and housing. You've turned empty lots into incredible, vibrant community spaces. And through Trust Her, you've partnered with other institutions, including Parkland, to provide access to contraception across the community. Thinking about this data-oriented mindset, a recent Guttmacher Institute study comes to mind for me. And the study demonstrated what a lot of us know anecdotally to be true, right? There are wide gaps between the contraceptive method that people say they want to use and the method that they're actually using. Again, it comes back to access. We're gonna have a couple of themes that run through this conversation tonight. So, given your grounding in data, can you discuss some of the barriers that women and girls have to accessing contraception in this community and why this is such a tough issue to solve?
Thanks, and happy to do that, and it's good to be with everybody today. Before I kind of get started, isn't this building really, really nice? Like, isn't this room incredibly beautiful? And it creates an incredible experience for all of us here today to spend some time together. And I think that's kind of the theme that I want to talk about, which is experience matters. Like, the experiences which we have, like, you have more confidence in the institution of Parkland when you're in a room like this. This is a great investment to create this experience for all of us. And we should be as concerned with the experience that every patient has in Dallas, right? And so the most important data that I think is often missing from government systems, from nonprofit programs, from the social sector, is the data of customer service, right? Customer service metrics, right? Which is kind of what Lauren was just talking about. Like, what's a more important and simple customer service question than, did you get what you came here to receive, right? Look, okay, so here's, Lauren cited a national study which basically said that often women who come in for a contraceptive counseling appointment are unable to get their method of choice. I will tell you, when we started Trust Her 5 years ago, and by the way, just think about that, just 5 years ago, we were talking about a very different environment in terms of rights, right? So a lot of things. So we were in a better situation theoretically 5 years ago in terms of the landscape than we are today, but for a lot of incredible proactive work by many people across this community. But here's what researchers from the Texas Evaluation Project at UT Austin, they went and they started surveying and doing deep research in community colleges, including Dallas Community College. And what they were trying to find out is, for women that had proactively gone, that are community college students that proactively gone, sought out contraception, what was the method that they were hoping to receive? And what they found was 69% of the community college students were surveyed said they were looking for longer acting forms of contraception. So IUDs or rods or, et cetera. And only 30% were able to get it, right? 70% if cost wasn't a barrier, if scheduling wasn't a barrier, and less than half that were looking for a longer acting form of contraception were able to get it. So that's what we've got to fix. And there's a whole host of different reasons why it's difficult. So, just scheduling an appointment is not a walk in the park, right? Particularly for teens. There's one teen birth, every 25 minutes in the state of Texas, okay? And we're not making it easy for teens to have access to the resources that we have. When we started this effort with Parkland a number of years ago, most of the clinics were only open during the weekdays, during school hours. That wasn't optimal given the stated goal. And so what's most important is not to use data to admire the problem, right? If you've been, that's what we always say. But what's really great is that you've got an institution here that cares about knowing that so that they can take action to fix it. So you heard Fred talk about the fact that now you've got Saturday hours for contraceptive counseling appointments. You've got extended hours beyond the school day. That's really, really important. And what you're about to see, and I know I'm spoiling the surprise, okay? I know that, but think about it. We're able to bring institutions together. Okay, so here's the other thing. Let me make this point, and then I'll talk about the mobile clinic. But the other thing the data will show us, when you've got literally one teen birth every 25 minutes in this state, right? When you have a local in Dallas County, a teen birth rate that is not quite, but what 84% higher than the national average. So I was going to say almost double, but 84% higher than the national average. You have a problem that is bigger than any one entity. Dallas is not a singular entity. What we know is we have a problem of scale. That necessarily needs Parkland government to be the anchor, but also necessarily needs this to be bigger than any singular entity. And so we're trying to bring groups together to work on the problem and to see Parkland and our community college, Dallas College, work together and then engage philanthropy. And so many people in this room have been part of already giving to these efforts to say what we need is a mobile clinic that will rotate around and make sure that every one of our community college campuses, that kids there have access to good contraceptive counseling and free of cost their choice of contraception, so that when we ask the question, did you get the form of contraception that you came to get? The answer is, I had a good customer service experience. I was able to get the product I came for.
Absolutely. Thank you. Dr. De Silva, you're next. And I'd like to discuss the role of preconceptive care in this whole ecosystem. So we've talked about contraceptive access, and just for the audience, if that's not a term you've heard before, preconceptive care is the state of a woman's health before she becomes pregnant. So it's really looking at the risk factors and the different conditions that could affect a woman, possibly her future pregnancy or both. But we're trying to provide counseling and screening and reduce any risk factors in advance of possibly becoming pregnant. So where does preconceptive care come into play in the system, and where is that type of service available in Dallas County?
Hi, everyone. I have big shoes to fill after listening to my panelists. So I really think about preconception care not only in the time when a woman is planning pregnancy, but being able to allow women to plan pregnancies. And so in order for them to be able to plan pregnancies, we need to provide the tools such as contraception so that they can really space out pregnancies and plan their pregnancy. Because if we can plan pregnancies, women are going to try to be their healthiest. They're going to try to have good behaviors while they're trying to get pregnant. They're going to know they're pregnant sooner. And the data, Alan's a data guy, is very clear that if we can plan pregnancies, children are born healthier. There's less NICU stays, there's less preterm birth, there's less childhood obesity. If we can plan pregnancies, teenage patients finish high school, right? They can potentially finish college, they have better incomes, we decrease childhood poverty. And the same goes for if patients can space their pregnancies to have time for their bodies to recover between pregnancies. And so for me, preconceptional counseling is really, it's as important to provide the birth control that patients want so that they can then be their healthiest selves and have the least risk factors for when they get pregnant.
We've touched on providing tools and choices and counseling. I want to go a step earlier in the process, maybe doing this a little bit out of order, and talk about education. So many of you may already know, or you won't be surprised, but sexual and reproductive education is limited to Dallas students if their parents opt in. So instead of the default being that we provide all students with this information and some can opt out, you have to proactively say, yes, my child can participate in this. Knowing this, where can young people go to get the science-based information that they need on these topics to be informed, to make the choice, to get the access, to do all of these things that we're talking about?
So I think the first thing, and my beloved husband is here, we have 4 kids. Your children, whether they are yours by birth, by choice, by chance, want to hear from you about not just what the facts are about how their bodies work and what sex is and how people can have sex, but what your values are around sex. And so what that means as parents, caregivers, is that you have to get comfortable with being uncomfortable. I mean, and that would be true even if every kid who was enrolled in DISD was getting comprehensive sex education. That would still be true. In terms of practical support, I have 2 recommendations. The first is that Planned Parenthood has an app called ROO, R-O-O, that is geared for young people who are seeking information about their health, sex, sexuality. It is anonymous, it is confidential, and young people can access it 24/7. And what we're finding is that a lot of young people actually want to be able to communicate via text or messaging versus picking up the phone and calling someone. If you have younger kids, Roby Harris, R-O-B-I-E, has done a series of really awesome books that are based in science. And the 2 that I recommend the most, it's so amazing, kids 9 to 11, about sex and sexuality, and It's Perfectly Normal, which is for kids 7 to 9, which are great books that you can just get and you can read them as a family, or you can tell your kid, these are on the bookshelf, you can read this, and we can talk about it if you want to. So there's kind of like whatever the speed is comfortable for your parents, for you as parents, or you as a family, or you as caregivers. But that's where kids want and need and deserve this information is from the people who are caring for them.
So first of all, I like that. You need to get comfortable getting uncomfortable. I have a great team that loves to come up with reproductive health trinkets, and they gave me an IUD keychain, and I was uncomfortable.
I really want an IUD keychain.
We can make that happen. Look, I'm not just worried about our ability to get education out there. I am incredibly terrified by the amount of misinformation that is out there and proactive misinformation. So in the news, a lot of times we hear about misinformation campaigns that are tied to political elections. I'm telling you, the misinformation campaigns are going directly to teens to try to scare teens off of reproductive health care. That's happening. Millions upon millions of dollars are being pumped into this. And so it is not enough just to create places where teens and women of reproductive age can get good information. We're going to have to be very proactive about making sure that good information is brought to not just young women, but parents, practitioners. The misinformation is everywhere. And so that's kind of what we're doing. We're not going to wait for schools to do that. we've launched an initiative called Ask Her, where we're going and just setting up kind of trade show style tables in all sorts of different public squares across Dallas. And while we are not able to bring the entire clinic with us, what we can do is bring very good information. And we initially set this up for young women across Dallas, particularly teens. Here's what we have found: every time we set up a table, we get swarmed by parents who are very concerned about this issue and very concerned about how to have this conversation with their teens, and very concerned with what resources are out there. But there is not a lack of demand for information. I'm not kidding. Everywhere we set up one of these tables, it is swarmed by folks who are looking for this information. So that's important. The other thing that I will just say is, let's not just pretend like good information is needed outside of the medical community, right? So we have phenomenal practitioners and folks that are on the front line inside of women's clinics and inside of clinics that are set up to provide contraceptive counseling. But what we're really trying to start to do is train family practitioners across Dallas who do not get training on things like IUD insertion in their general training. Well, they need that, right? This is, when we say that reproductive health is basic healthcare, we have to mean it, which means that we have to make sure that it is available in basic healthcare spaces. And so, again, what's really important, I think, for everyone to understand as we're here to not only talk about this issue, but understand what an important role Parkland is playing, is yes, Parkland is playing a role in doubling down and getting serious about it within its own direct care, but it is also very much coming to the table and trying to figure out how to be helpful to the network of healthcare across the entirety of Dallas. And so we're very appreciative of the partnership, the expertise that folks like my friend Rupa bring to this effort.
Well, just to piggyback on what y'all have said, I really do think that healthcare providers are sort of the backbone of this whole thing. So when people don't know, we need to know. And I think, like Alan said, some of us are not comfortable being uncomfortable. And so I think that we need to really also talk to healthcare providers and get them comfortable about talking about this conversation. And part of that is just destigmatizing this conversation. It shouldn't be something that is, it might be uncomfortable, but it shouldn't be something that is everyone's nervous about talking about. And I think it's really important as healthcare providers that we wrap ourselves around this conversation as well.
Okay, Dr. DeSilva, I'm going to come right back to you again. So we heard both Parkland and the Dallas County Health and Human Services have reported a rise in sexually transmitted infections as well. Can you talk to us a little bit about the possible causes of that and what might be done to address and hopefully reverse these trends?
Yeah, this is a sad question, and I'm sorry to see that the trends are going in the wrong way. And I think a large part of it does go back to education and misinformation. And I think, teenagers tend to, if you look at the data, have more sexually transmitted infections than older women. And so I really think that there's good data that the frontal cortex, which is the part of our brain that deals with consequences, is not fully developed in our teenage years. And so that could explain a lot of things. So I really like to think that teenagers are not out there trying to get an infection or trying to get pregnant, but rather that they have not really thought through all the consequences. And so we, as their guardians and their healthcare providers, really need to be their frontal cortex and really help educate them about consequences, have them think through those scenarios, and have them understand, the consequences of intercourse, of healthy relationships, and all of those things that surround us. And so I really think that, and part of that is, just like I was talking about, is making that conversation okay, and making it okay to have it at the dinner table. And that's hard. But I think at Parkland, we are really working to try and create those conversations, like Alan was saying, and really, I agree. Like every time I talk to a child, the parent has more questions because they didn't know how to bring that up, and so I think it's really important to make this a whole family affair. And I think also we need, in terms of how we can improve that, it really is about meeting people where they're at, and that's where the mobile bus will really be helpful. So we need to, it's hard to make an appointment and then your mom or yourself has to bring yourself, stop work, stop school, whatever. And so we really need to go to them and make it easy for them and make it a one-stop shop and give them their method of contraception of choice. And we're working on that at Parkland. We need to give it to them right after they have babies. They don't have to think about it. They need to go to their postpartum visit, but so that they don't have to think about one more thing they have to do. We need to really meet people where they're at.
Amy, when we think about the size and scope of the need in Texas, right? There's 14.1 million women and girls in Texas. That's more than the entire population of Pennsylvania, right? That's just the women and girls here. So issues that affect women and girls in Texas, the impact is just really almost unmatched. We need institutions that can stand in the gaps and ensure that every one of those women and girls don't fall through the cracks. Can you talk to us a little bit about what organizations, whether they're funders or service providers, can do to help make sure we serve everyone?
Thank you, Lauren. I think the top line here is that what happens in Texas doesn't stay in Texas, and not in a cool way. Right now, Texas has one of the highest rates of teen pregnancy, the highest rate of repeat teen pregnancy, and the highest rate of Black maternal mortality, the latter being in the developed world, not just in the United States. In addition, because Texas has not expanded Medicaid, millions of people who could have access to high-quality health care are forced to pay out of pocket when they go to the doctor. And that simply means that many people are not able to seek care. And the cherry on the top here is because of a recent ruling from a federal court. Previously, minors were able to seek confidential contraceptive care through Title X government funding without parental consent, and teens are no longer able to do that. So we are dealing with a profound healthcare crisis of our own making in Texas. That's the bad news. It's pretty bad. But the good news is that we have organizations like Parkland, like Planned Parenthood of Greater Texas, like CPAL, who are working to provide every person who wants access to contraception with access to contraception, to their preferred form of contraception. We also have amazing organizations like Viola's House, like Abide's Women's Health Services, like Delighted to Doula, that are doing incredible 360 degree care to reduce Black maternal and infant mortality, to make sure that every person who is pregnant, especially in places like South Dallas where there are fewer healthcare providers, has access to their preferred form of healthcare, whether that is in a traditional hospital setting like Parkland, whether it's with a doula or a midwife for a pregnant person. And for me, I think our role of funders is a couple of points. First, for us to do the work to really understand the problem. And that includes educating ourselves as parents or people who love little kids or teens, to understand what their needs are, to understand the way that our kids and young people think about gender, sexual orientation, and their identity, as whether it is as a cis person, a trans person, a non-binary person, that we do the work to meet young people where they are. As funders, what I think that looks like is really leaning in to unrestricted grants. What we're seeing is a healthcare landscape that is changing so fast. I've been in the reproductive rights, health, and access movement for a long time, and the changes that we have seen in the last 2 years in Texas and nationally are changes that none of us was prepared for. And so I feel like our calling as funders to do what we can to give the organizations that we support the room to run, the room to try new things, the room to say, this thing we tried that we thought was gonna work isn't, so now we need to be able to do something else. So that's my call to action. If you are in this space, if you are in a funder space as supporting any healthcare organization, and for the Boone Family Foundation, Parkland is one of our most valued partners. That is the way that I hope we can all show up right now.
Okay, I think we have a few minutes, so Alan, I've got one more for you, and then if we have questions, if you want to pass those in, so we can, if we have time, get to a few of those. But building on what Amy had to say, I've got a somewhat similar question for you. We've talked a lot about healthcare, but we know that increasing access alone isn't going to solve the problem, right? If that was just the problem, this would be easy. We could build more clinics, right? We could have more appointments. It's necessary. It's just not sufficient. So from your perspective, in addition to providing great access to contraception, what other critical steps can our community take to address unintended pregnancies?
So there's a lot. I don't even know where to begin in some ways, other than to say this. Like, I don't want anyone to leave this room where we're talking about a lot of, I'm going to say some celebration points of some of the things that Parkland has done. I don't want anyone to walk away thinking that everybody's feeling just great right now. Okay, everyone is frustrated. Everyone is frustrated, right? And they're not just frustrated, they're scared. So when we're talking about rights, we're not just talking about rights of patients, we're also talking about the rights of medical providers and understanding, like, what can I and can't I do for this thing that I have dedicated my entire life to, right? And so one of the most important things we can do is have great empathy for those that are caught in the middle. And I'm just going to tell you, just in this room alone, there is an awful lot of, I'm going to say, affluence and influence, and an awful lot of safety that can be created. So when somebody is scared and they're trying to figure out, do I do the right thing, knowing that they're going to have a community that backs them and not a community that hits them over the head for things that are beyond their control is really, really important. And I'm just going to tell you, creating a good environment for a front line of healthcare providers to come in and do what we want them to do, which is care about their patients and serve patients. That is about the best thing we can do as a community to fight this, is create the type of environment, irregardless of anything else out there, where folks know that they are part of a community that cares.
Okay, I just got the 5-minute warning. I'm going to ask the very first question here, and then we're going to need to wrap it up. But I think the first one is a fairly direct question. So possibly for Dr. De Silva, but if someone else wants to jump in, how are we supporting young men regarding their reproductive health?
That's a great question. So in our Parkland systems, in addition to offering contraception for teens, we do educate them about condom use and about STIs, and we can test them for infections. So we do have those services. We also educate, just about the risks and the need for healthy relationships.
I think, Dr. Silva, that's such a great point, and I think that when you if you think about reproductive rights, health, and access, that is a space that is very inclusive for men, for women, for non-binary, for trans folks. Because what we're working towards and what Parkland is at the front line of is an environment in which every person gets to control their body, gets to be in charge of safe and healthy relationships, and gets to plan the size of their family and the spacing of their children, whatever that looks like for them. So that's an awesome question, and that is absolutely inclusive of the vision that I think everybody in this room is striving for.
No, absolutely, and I think, the other thing that I think is important is that we include gentlemen in the contraceptive conversation that they have with their girlfriends or wives or whatever. So we really try proactively to have them be a part of the conversation.
Yeah, listen to men. What don't leave us with that as a this is not being, God, it's being recorded. Horrible.
This is getting carried away.
Okay, I got permission to ask one more question, but I really want to end on that. These are great questions. Thank you all for handing them in. What else can we do? Who can we partner with to increase access to and compliance with family planning methods and contraception? So who can we partner with? What else can we do?
I think the main thing is to, if you're a funder, talk to the people who are on the ground. Parkland, Planned Parenthood, Viola's House, Delighted to Doula, Abide Women's Health Services. And I always think that there's a ton of value in philanthropy about not assuming as a funder that you know what the solution to a problem is. In fact, people who are closest to the problem, if we're really operating in a trust-based philanthropy framework, which is something that's very important for the Boone Family Foundation, we believe the people who are designing their own liberation, their own freedom. And we do what our partners on the ground ask us to, because they know what they need, what their communities need.
Okay, thank you all so much for sharing your expertise with us today. In closing, I would love if you could take a very brief moment, because we have run long and I need you to be very brief, to just tell us why you as an organization or as an individual choose to stand with Parkland in addressing what is really one of our greatest current health crises.
I stand with Parkland because they're amazing, but also because they work really hard to meet people where they are.
So this is like a push-pull question. So I stand with Parkland, very honestly, because Parkland, when we asked for partnership, was willing to partner with us and has been willing to partner with the rest of the community. I think it's as important to ask, is Parkland willing to stand with Dallas? And the answer right now is a resounding yes.
Ditto. I just have to say, on a personal note, my mom was in a really serious car accident in 2008. Parkland saved her life. So that is also a big part of why our family stands with Parkland.
Thank you again. And before I turn this over to Dr. Horn again, I would like to just take a brief moment, moderator's privilege, to share why Leland Fikes Foundation supports Parkland. So those of you that know the foundation know that we're deeply invested in reproductive health rights and justice across a range of different strategies, a range of different sub-issues. But supporting the family planning expansion at Parkland was an absolute no-brainer. For us, it is a natural complement to the support that we provide CPAL, to the support that we provide other direct healthcare providers, people working in the reproductive rights space, doing litigation, all sorts of strategies. This is a beautiful complement, and Parkland's scale and their reach in Dallas is absolutely unmatched. There are 10 clinics spread across the entire county. So for us, we've made a multi-year commitment to this work. And we are so pleased with the progress that Parkland has made over the first couple years of this. So my ask of you all today is that when the Parkland Foundation team calls in the next couple of days, in the next week or two, take the call. Just take the call and talk with them and listen and learn more. Share what you're interested in and see if that's a match for what Parkland's doing. I'm really optimistic that it will be, but you get to decide that. Just be willing to have the conversation, please. Thank you all, and Michael, back to you.
What an amazing conversation. Thank you so much. Can you join me, please, in thanking our panelists one more time? So, 13 years ago, like many parents, I was blessed to hold on my chest our daughter, Bailey Horn. And in that moment, right, full of exuberance and jubilation, like many parents, right, there was also that like fear that overrides you when you think like, what kind of world am I bringing my child into? Fast forward, our daughter is thriving here in Dallas, but she's a teenage girl. And when I think about the context that we described, the world in which we are living in, right, there is the concern, right? There is that fear. There is also that frustration and anger as it relates to what could be the possibilities for Bailey and for countless girls and women across Dallas County. I also am someone who really believes in optimism, and part of what drives me every single day is knowing that we have institutions like Parkland that are here to stand the gap, that we have institutions like CPAL, that we have philanthropic investors that have taken the bold step to ensure that a storied institution like Parkland can certainly drive forward, can realize the mission that Dr. Cerise spoke about, and ensure that irrespective of background, of zip code, of ability to pay, that you can receive the services you need, but not just receive the services you need, but do so in a way that is full of hope, compassion, and dignity, right? Which is what I feel when I walk across our campus, and certainly in Alan, as you talked about, in a space such as this. And so, a couple of things that I want to leave you with. One, I want to bury the lead. We've talked about it already, but we really invite you to take a few minutes before you leave our campus to tour our new family planning mobile van. It's amazing to think about this idea of proximity and ensuring that we are bringing services. It's again a sign of respect, and also thinking about compassion, empathy, and dignity, which is the heart of our mission here at Parkland, right, to our patients. And so please take a tour, get excited, meet some of our leaders from our women's health program to learn more about what we're doing. And certainly our foundation team that is scattered across the auditorium can help direct you to the van. I personally want to thank all those who have taken the call, certainly, who are standing with Parkland, who certainly believe in trust-based philanthropy and certainly investing with us. This isn't charity, and I know that all the folks that are here know this isn't charity. This is an investment, this is a partnership. And we thank you certainly for what you are doing to ensure that we can really meet and overcome in some way this unprecedented crisis that we are facing. The goal really, just to really summarize what we're trying to do here, is really guided by a three-pronged approach, right? Again, one is making sure that we're providing access to reproductive health services across Dallas County and ensuring that individuals have the contraceptive of choice, right, in a way, in a manner that is most meaningful for them. And that we are continuing to confront, right, the challenges of misinformation through education, factual information, and certainly respect. Our ask certainly is simple, right? One, you've already kind of answered the call by being here, and so thank you. We invite you when we call when we send an email, when we reach out, please take the call, right? Meet with us, right? We want to start a conversation. We want to establish a relationship. We want to find out ways that we can meet your friends and colleagues and neighbors, right? And we're happy to do that. There are members of our team across Parkland Health Foundation that are here tonight that would love to visit with you and have that conversation. But ultimately, I want to just say thank you. Thank you to our panelists. Thank you all for being here on a Thursday evening, which is close to Friday. And so we hope that you have a wonderful and safe journey to your next destination. I would encourage you to check out the van. It is the jazziest thing that you will see. And thank you so much for standing with Parkland. Have a wonderful evening.